The first and one of the most definitive clinical trials we've had up to date was the FAIR-HF trial, demonstrating the benefit of IV iron therapy in a modest-sized heart failure with reduced EF population and iron deficiency, defined by the standard definition with a ferritin level less than 100, or if ferritin is between 100 to 300, requirement of a TSAT level less than 20%. In this trial, IV iron therapy with ferric carboxymaltose resulted in significant improvements in a variety of patient-reported outcomes. These included improvement in quality of life, NYHA functional class, self-reported patient global assessment, as shown on this slide, as well as a 6-minute walk distance. With IV carboxymaltose compared to placebo over 6 months, regardless of the anemia, presence of the anemia or absence of the anemia in these patients. These results were subsequently confirmed by the trial titled CONFIRMED, in which treatment of symptomatic iron-deficient heart failure patients with carboxymaltose, this time over a year, resulted in significant improvements in performance by 6-minute walk distance, functional capacity, symptoms and quality of life that became detectable as early as almost 6 months and was sustained throughout the year. And this study was also important because it was one of the first studies to demonstrate reduction in clinical endpoints, specifically reduction in heart failure hospitalizations with IV ferric carboxymaltose in this study. Adverse events and mortality rates were comparable, neither adversely or beneficially affected in terms of the survival benefit with the IV carboxymaltose. There are a few studies examining the effects of IV iron therapy on cardiopulmonary exercise performance by peak VO2 measurement. This is one of those studies called the FAIR-HF trial. This is the first FAIR-HF trial in a small size 35-patient trial with baseline low peak VO2 levels and iron deficiency when treated this time with IV sucrose over 18 weeks resulted in significant improvement in peak VO2 compared to the control group. Benefits were present both in the anemic and the non-anemic patients, but benefits were more pronounced in the anemic patients. Similarly, in a second study called the EFFECT-HF trial, in 172 patients and iron deficiency, IV ferric carboxymaltose was associated with significant improvement compared to placebo because placebo demonstrated decline in peak VO2, whereas in the IV carboxymaltose treatment group, the effects were rather flat, and improvement in NYHA class at 6 months. This slide summarizes the clinical trials for iron deficiency or for anemia in heart failure with a color code for the type of iron repletion therapy used. As can be seen, most of the studies that I have already gone over were carried out with ferric carboxymaltose, shown in blue on this slide, or iron sucrose, shown in red. And I will also follow the single oral supplementation study, the iron out study shown in green, as well as the erythropoietin stimulating studies shown in purple later. There have been a few meta-analyses examining the effect of IV iron therapy in iron-deficient heart failure patients. All of these meta-analyses concordantly showed significant improvement in patient-reported outcomes and functional capacity. And these specifically included improvement in quality of life measures, NYHA class, and exercise performance with 6-minute walk test, as well as peak VO2. Additionally, in one of the recent meta-analyses, performed at the individual patient data level, including 4 clinical studies with IV carboxy maltose. The treatment of iron deficiency in HFrEF patients was associated with reduction in hard endpoints, as seen on the slide, with reduction in cardiovascular hospitalizations and cardiovascular mortality.